Okay, we're here to talk about ICD-10 codes for mental health and neurodevelopmental disorders. These codes all begin with the letter F and go from F01 through F99. F01 through F09 are any mental disorders that are due to known physiological conditions. F10 through F19 are mental and behavioral disorders due to substance abuse or use. F20 through 29 are the schizophrenias and the other non-mood psychotic mood disorders. F30 through 39 are the mood affective disorders. F40 through F48 are anxiety, dissociative, and stress-related disorders. F50 through 59 are behavioral syndromes that are associated with physiological disturbances. And F60 through 69 are disorders of adult personality and other behaviors. We also have F70 through 79 intellectual disorders. The F80 through 89 are the pervasive development disorders. And then 90 through 98 behavioral and emotional disorders with onset occurring in childhood and adolescence. And then F99 is unspecified disorders. Something you'll see referred to is DSM-5. DSM-5 is the Diagnostic to Statistical Manual of Mental Disorders. It's the 5th edition, hence the name or acronym DSM-5. The names and conditions utilize these, and some codes, why they don't match it exactly, you'll see some references to DSM-5. You'll actually, if you work in a mental health facility, you'll actually have this as a reference because that's the terminology that psychiatrists use. If you're interested in DSM-5, you can look up psychiatry.org. DSM-5 provides descriptions and diagnostic categories that allow clinicians to communicate and study and treat patients. There are different definitions in DSM-5, but having said that, the coders must assign the codes that are based on medical record documentation. There are some things that you see out there about if somebody's on this medication or that automatically means they have major depression or this, that, and the other thing. That's not a good way to go about coding mental health disorders. It basically goes with what is in the documentation. DSM-5 contains dual codes as well as the new ICD-10-CM codes. The ICD-9 and ICD-10 codes are included in parentheses. That way we can reference them. Some electronic health record systems have what they call crosswalks. They're really kind of gems that kind of link all these. So these are just there for reference purposes. And again, one of the key things in this chapter, and something you should be familiar with, is this kind of terminology. We can use a substance, we can abuse a substance, and we can be dependent on it. And this is all based on the documentation from the provider. And we see a lot of this with alcohol and other medications and substances. And we're going to be looking at these things by the alphabetic terms. In your text, you'll see a list of some of these main terms. And one that they talk about is alcoholic pancreatitis due to alcohol dependence. So you would follow the instructions in the tabular and assign the appropriate code for the alcoholic pancreatitis, the K85.2, and then the main term being dependence alcohol. We can also have alcohol dependence uncomplicated. Let's take a look at some of the things that we'll see with the main term of dependence. As you can see here, we have a main term of dependence in bold, and then we have alcohol, and everything that follows with F1020 in terms of with, are all the other things that can come with alcohol dependence. You can have anxiety disorder, dementia, intoxication with delirium, all these different types of things. One of the important things in this chapter is to read all the instructional notes. And you'll see some of them here in terms of pain disorders. If people have pain that's caused by psychological factors, you have a code for F45.41, and then other notes in there, as you can see here. Let's take a look at F45.41. And as discussed, you can see some of these very important notes here in red. Code also associated acute or chronic pain, the G89. And then throughout this chapter, you'll see these notes in red, code first. All these different types of things. So very important to read the tabular very carefully once you get a code. There are other chapter-specific guidelines for psychoactive substance abuse, use, and dependence. So 3 very important things to keep in mind that you need to keep reading for what is use, what is abuse, and what is dependence. And again, as we talked about, there are a lot of notes to code related conditions, pancreatitis, some of these other things that you'll see. And then sometimes there'll be notes to assign an additional code. And we can see an example here, F01 for F0151, vascular dementia with behavioral disturbance. And then you would use the additional code to identify wandering if appropriate. Let's take a look at F0151. Again, another example of those red notes, use additional code if applicable to identify wandering in vascular dementia. And likewise, you'll see similar notes in F07.0, personality change due to known physiological condition. Other notes under F54, psychological and behavioral factors associated with a disorder or disease classified elsewhere. Let's take a look at F54. And again, very important to look at some of these right here. Code first, associated physical disorder, the asthma, dermatitis, gastric ulcer, colitis, ulcerative colitis, etc. And I'm just going to skip over F84. I think you get the general idea of this, that there'll be notes throughout this chapter to apply additional codes if they're documented. There are also inclusion and exclusion notes. Like for instance, inclusion note says that ecstasy, PCP, phencyclidine are included in hallucinogen-related disorders, and they give some examples of that. There are other inclusion notes that identify what conditions are included with F44. That's all I have for you right now. Please come back and we'll talk more about alcohol use, abuse, and dependence.